What's the difference between toughness and strength when it comes to treating runner's knee? Runner's knee is the common term for patellofemoral pain, which means pain in the patellofemoral joint, and it will usually feel like pain on the back of the kneecap or a general diffuse pain around the front of the knee. The patellofemoral joint is the joint between the back of the kneecap and the thigh bone, which is to say the patella, which is the kneecap, and the thigh bone, which is the femur, which is why it's called the patellofemoral joint. And when you land, when you're running and bend the knee a little bit, the back of the kneecap will press up against the thigh bone. And that joint there, the patellofemoral joint, that's where you can get pain coming from the back of the kneecap because of that pressure. Now, for a long time, the medical world has been coming around to the fact that if runners have patellofemoral pain, so if runners have runner's knee, becoming stronger seems to help reduce their symptoms and often gets rid of them. And when I say stronger, that means they make the muscles, the quadriceps, the hamstring, the calf muscles in particular, stronger. Yes, the gluteal muscles a little bit and the core muscles a tiny bit, but mostly the leg muscles. When you make those muscles stronger, it seems to help alleviate the pain and allow runners to run more. However, what I'm talking about here is not strength. We're not trying to make the muscles stronger. What we want to do, as well as make the muscles stronger, is make the back of the kneecap tougher. And what I mean by that is the actual cartilage on the back of the kneecap that lines the back of the kneecap and the bone underneath it. Those two structures, the cartilage and the bone, are living structures that will adapt to the stress placed on them. And they can become tougher and more resilient if they're loaded appropriately by things like running. And they can become weaker and less resilient if they are offloaded by things like resting. This is why I'm so against rest for running injuries. Now, it is okay for kind of up to about 2 weeks, but beyond that, it becomes unhelpful because it allows the structure, in this case, the back of the kneecap, to be offloaded to such a degree that it loses its toughness. When the kneecap becomes less tough, it is less able to tolerate the stress of running, which means when you try and run on it, it hurts more. This leads to an all too common situation where a runner will get runner's knee, so pain on the back of the kneecap. They'll go to the doctor who will tell them to rest and go to PT. It'll take a couple of weeks to see PT. Then when they go to PT, the PT is not a runner and will tell them not to run and do usually glute exercises for some reason, but they'll get them to do some exercises. And 3, 4, 5 weeks will pass when nobody has even tried to assess how much that runner should be running. The trouble with offloading the back of the kneecap for 5 weeks as soon as you get runner's knee is that you will lose a lot of the toughness that you've built up in the back of the kneecap. If this persists for 2 months, 3 months, 4 months, 5 months, the way it often does, you get stuck in this cycle where you're resting from running. That means that the kneecap is getting weaker and weaker. It's getting less and less tough. So when you go to try and run on it, it hurts. So you then think, I better not run on it because I don't want to damage it. And you get this horrible, vicious cycle where the less you run, the more it hurts. So what we need to do to reverse this is to use running as the rehab. This is why I always say that running is the rehab, and it's one of the most important things. When we look at our 3 critical components, I've talked about being resilience, strength, and form. Now, so I'm going to more refer to it as toughness, right? The toughness of the structure, in this case, the back of the kneecap, is the base of the pyramid and the most important thing. The strength of the muscles around it is the second most important thing. And finally, the form or the biomechanics is the top of the pyramid. It's still important, but not as important as the other 2. So if we have these 3 critical components where toughness makes up the base of the pyramid and is the most important thing when it comes to getting rid of any running injury, but particularly in this case, patellofemoral pain or runner's knee, we have toughness at the base of the pyramid. Now, toughness is made up of 2 factors. We have the capacity of the tissue and we have the sensitivity of the tissue. So the capacity would be something you could see on an MRI. So if you were to take an MRI of someone's knee, you'd be able to make some descriptions of how healthy that tissue is. However, what you can't see on an MRI is how sensitive that tissue is. This is why we often see runners with significant tissue changes on their MRIs where they have significant loss of cartilage, cartilage defects and other such things, or they have significant bone bruising and arthritic change. However, they don't have very much and sometimes no pain. And in that situation, it's because the health of the tissue is quite low, but the sensitivity is also low. What we also often see is runners with perfectly normal MRIs where the tissues and the actual structures of the knee look fine, so they're healthy, but the sensitivity is quite high, meaning it hurts when you run on it, even though there's actually nothing wrong with it when you look at it. And what we can often do with runners who come to us, who've tried lots of other things, which usually involve a lot of rest, injections, surgery, time off running, is to dose the running in such a way that we get the toughness to increase on the back of the kneecap or whatever structure we're talking about by reducing the sensitivity of that tissue, by exposing it to the thing that it needs to get used to. In this case, running. The most ideal scenario would see that we had really healthy tissue that is very tough and not sensitive. So this would be a situation where if you were to take an MRI of, say, my knees, you can't see any arthritic change. The cartilage looks beautiful. The bones look beautiful, but also it doesn't hurt. I can run on it for like a whole marathon and it feels great. So the sensitivity is low and the tissue health is high, meaning that the overall toughness of the joint is really high. However, if you're listening to this and thinking, well, that's great for you, but what about me? I've got arthritis on the back of my kneecap. I've got arthritis in my medial compartment of my knee. I've got a stress fracture in my shin. I've got a tendinopathy in my Achilles tendon. The tissue health is quite low in those situations. But what we can do is reduce the sensitivity, meaning that when we expose the area to running in a graded and progressive way that's titrated precisely and progressed at the right rate, then we can get the sensitivity of that region to reduce so it becomes less painful. When it's less painful, you're able to do more on it. If you continue that cycle to the point where you can run more and more and the pain is going down because you're getting the dosage just right, over a few days and weeks, you can get from, not being able to run at all to being able to run for a few hours. Now, this is great. We have lower sensitivity now, which means that we can run more. If we then continue that for months into years, we can actually see effects on increasing the tissue capacity. So we can take unhealthy tissue that's arthritic and degenerated, and it can become healthier. Now, there are limits to this. Obviously, if you have significant arthritic change, completely reversing that is pretty much impossible. But if you are healthier, over the next 10 years, your knee joint will be healthier. So we can slow the rate of decline by running. And this is why we often see in studies looking at runners, they have knee replacements less often. They have knee arthritis in lower rates. And this is because they are healthier people overall. And one of the ways in which they are healthier is they have tougher joints, and they are tougher in terms of the actual structures themselves. They look like they can tolerate more stress, but also in terms of their sensitivity, which you can't see. You can measure that they can tolerate more stress by looking at the amount of running they can do compared to how much pain they feel. So the takeaway message is that when you are trying to get over any pain, particularly in this example, runner's knee, pain on the back of the kneecap, do not avoid running. That will reduce the toughness of the back of the kneecap. It will become more sensitive and less able to tolerate the stress of running. Yes, we do want to increase the muscular strength. We also want to increase the toughness of the back of the kneecap. When you do both, you put yourself in the strongest position possible to actually be able to run more. When you can run more and continue that for months on end, you'll become healthier. When you're healthier, you'll have healthier knees. And then the icing on the cake here is the form. If you also run with really good form that puts very little stress on the back of the kneecap compared to what it could do, then you're just going to make it that much easier for those other two factors to be that much more effective. So think of it that way. The cake is made up of the toughness of the tissues, of the structures, and the strength of the muscles, and the icing on the cake is the biomechanics, moving well, running with good form. And when you get all three dialed in, that's how you can get out of pain and back to pain-free running. That's how you can keep running for the long term and create a situation where you become this kind of unbreakable runner who can run as much as you want. And if that sounds like something that you're interested in, obviously we want to talk to you. Click the link in the description as usual, book a call, and we'll have a chat about how to get you past your knee pain, make your structures tougher, back to pain-free running, and start creating that unbreakable runner.